Hello, I am Dr. Laura Dewalt from Chota in Madisonville. We are making this video to educate you about the COVID vaccine, which, as you probably have heard, is available right now for healthcare workers, people in the public over age 75, and people residing in nursing homes in Tennessee. At this time, and hopefully soon, will be rolled out to more people in the public. We are getting a lot of questions about the COVID vaccine, and we wanted to take this time to try to explain what the COVID vaccine is and address some of the questions that we are hearing a lot from our patients and members of our community. So, as you probably know, COVID is pretty common in the whole country and especially here in Eastern Tennessee. I looked up numbers this morning, and I believe it said about 447,000 people have died in this country from COVID since its existence just about less than a year ago. So the COVID virus, as a lot of viruses do, it basically infects our body by taking over the machinery of our cells. So the virus enters our cells and kind of tricks our cells into making more virus for it. So how the vaccine works is that the scientists who made the vaccine have found a way to isolate just the genetic material for what's called a spike protein, which is on the outside of the virus. So in the vaccine is that those instructions on making just the spike protein. So our cells, when we get the vaccine, start making the spike protein, and then our immune systems recognize that spike protein as something that's not supposed to be there and mount a defense against it, so activate our immune system. And basically the vaccine allows our bodies to have a practice run for the COVID virus, so that our bodies and our immune systems can recognize the COVID vaccine if we ever come into contact with it, and our immune system knows how to fight it off. Basically, it's like our bodies are taking a self-defense class when we get the vaccine. Again, so it knows how to fight off the real virus. Right now, there are 2 vaccines available in the United States. One is made by Pfizer and one is made by Moderna. The most widely available here in our community is the Moderna vaccine, and that's what our health department here in Monroe County has available and is given out to those that qualify right now in this phase of vaccine rollouts. And that vaccine, you get the first dose, and then 4 weeks later you get the second dose. And about 2 weeks after the second dose, you should be about 95% protected. And what we mean by 95% effective is that you are 95% less likely to get serious disease from COVID. And if you do catch COVID, having had the vaccine, it should be a lot less bad, less likely to die, less likely to need hospitalization. So I have some questions here that were submitted to us, and one of them is, if you've already had COVID, how long do you need to wait to get the vaccine, and do you even need the vaccine? So the question is, we still recommend that you get the vaccine. The general recommendation is that you wait approximately 90 days after your diagnosis with COVID to get the vaccine. We think you have very good natural immunity for at least those 90 days, but we still recommend that you get the vaccine to protect you after those 90 days. And a lot of people are worried about their pre-existing conditions and is it safe for them to take the vaccine. The only absolute reason not to have the vaccine is if you've had an anaphylactic reaction to vaccines in the past, and what that means is a severe allergic reaction that affects your breathing. It's okay to take the vaccine if you're allergic to eggs, and pretty much any chronic condition it's still safe to take the vaccine. But if you have specific concerns, we would recommend that you talk to your doctor directly, since your doctor will know more about your specific conditions. Again, the vaccine does not contain any live virus. It's just genetic material for that one protein. So you cannot get COVID from the vaccine, and therefore a lot of chronic conditions do not increase your risk of having a bad reaction to the vaccine itself. The components of the vaccine are safe. Again, you cannot get COVID from the vaccine, and a lot of the kind of other components of the vaccine, like the preservatives, have been used in other vaccines and are felt to be generally safe. There have been extremely few vaccine reactions reported in the whole country at this point. What reactions can you expect from the first and second dose is another question. The most common side effects, or even what I would say natural response to the vaccine, is that after the first dose, usually you'll have quite a bit of arm soreness. The vaccine is administered into the muscle of the upper arm, so it is generally sore for 1 or 2 days, and you can have some redness at the site of the injection. Generally, with the first dose, sometimes you may feel a little under the weather for a day or two. Usually those types of responses are more common with the second dose. We're seeing a lot of our patients who get the second dose will have an immune response that may include fevers, aches and pains, feeling very tired, and maybe even a headache. And that is your body's natural immune system working to fight off that spike protein that it's recognizing as foreign. So that is a normal response, but you may feel quite, under the weather for 1 or 2 days, but it certainly would be a less intense response than if you were to actually get COVID, which can be many, many days and weeks of feeling like that, and would also necessitate time off work, whereas with the vaccine, perhaps you'll have a reaction that may require you to take 1 or 2 days off, but you don't need to be quarantined like for 10 days like you would for a real infection. So are there lingering symptoms after the vaccination? You should not have any lingering symptoms after about 2 days, maybe 3 days. So the vaccine itself is pretty rapidly eliminated from your body, and then it's just your natural immune response that can last a couple days. Then we kind of have some questions where we really don't know the answer for sure. So we have a question saying, after having the vaccine, how soon can I stop wearing a mask? We don't know this quite yet. We need to roll out more vaccines in our community in order to get what's called herd immunity, which means that there's enough people immune to COVID that the virus cannot easily jump from person to person to person. And right now the estimate is that we will need 75 to 80% of our community vaccinated in order to reach that herd immunity. So everyone should want to do their part, and we hope that you do your part in getting vaccinated to help other people in your community. Next question is, how often will we need the COVID vaccine? Again, we don't know for sure. There's still ongoing studies, and we don't know if this immunity from these first 2 doses will kind of wane or kind of drop off. Other vaccinations, for example, tetanus, do require boosters about every 5 to 10 years. Some require boosters in shorter intervals. So we don't quite know yet if there's going to be a need for a booster coming up in 1 year or several years later. Other people have heard about different strains of COVID being found in the world, And will we need multiple vaccines for these different strands? That's also not quite known yet. If the if the COVID virus can mutate the actual spike protein enough that our body doesn't recognize it from our vaccine, then there may be need for additional vaccines for other spike protein mutations. Again, we don't really know that yet. It depends on how much the virus mutates in the future. And then there's a lot of concerns among women about risk of pregnancy, infertility, and breastfeeding with the vaccination. So like all drug studies, pregnant women are not included in the drug studies just because of ethical reasons. But what we do know from a long history of vaccines in this country and worldwide is that it's generally safe for pregnant women to get vaccines that do not include live viruses. And the COVID vaccine does not include a live virus. So the general consensus from the World Health Organization and the Centers for Disease Control, the CDC, and the FDA is that we do not think that there's any risk to pregnancy or to breastfeeding for the infant, and there is no evidence that the COVID vaccine will have risks to infertility. I have a lot of doctor colleagues who are currently pregnant or breastfeeding or are planning to have children who felt it safe enough for themselves to get the vaccine. So it's generally recommended for everybody over the age of 16 for the Pfizer vaccine and over the age of 18 for Moderna vaccine to get the vaccine. Right now, the vaccines are not approved for children under those ages, mostly because it hasn't been studied in that population, but there are studies ongoing to hopefully expand the vaccine recommendations to children under the age of 16.
Okay, thank you so much, Dr. Dewalt. We hope this answers everyone's questions, and if you have more, you can leave them in the comments or send us a message, and maybe we will have time to do another video and address those. Have a great day.
Bye.